Hello. Hello, welcome everyone. So, this is our third day of clinical series from Desk of Homeopaths, and we have our speakers, Dr. Prabhakar sir and Dr. Chiraag Shah from Bombay. And this event has been organized by Homeopathy 360. So, I would really big thanks to them because they have been continuously promoting good message, promoting more events, and they're helping us a lot in order to make a good moment of learning during this lockdown. And regarding the homeopathic key, I would like to tell you we created this platform in order to generalize all very simply. We can provide all more information about homeopathy, homeopathic events. Like we can conduct webinars, we are conducting, and I would like to request everyone to support us, to give us a way so that we can reach each and every student in homeopathy. Basically, we form this platform in order to connect every homeopath in this world. So the main purpose of being part of homeopathic key is to initiate and to connect. And majorly, many students of homeopaths have a lot of doubts, and they are not able to clear up with their masters or whoever they want to ask. So we want to be a bridge to connecting everyone, and everyone can follow us on Facebook, The Homeopathic Key. That's the name of our platform. So we are members. We have our creators are me, Dr. Snehanshu Saha, Dr. Siddharth Singh, and there are many team members as well, whom we are conducting this whole platform. And I really request everyone to like us on Facebook page to be connected and to know the future events and upcoming webinars. So I think we are already running late. So now I would like to introduce Dr. Prabhakar sir. So today, Dr. Prabhakar sir, I would like to tell you he's a great homeopath from Mumbai. He has an experience of 35 years in his field, and he practices at Niramay Homeopathic Clinic in Andheri West, Mumbai. He has completed his college from CMP Medical College, Bombay, 2006. He has also LCEH from CMP Medical College, and he's a professor of organon and HOD at CMP Medical College. So today, Prabhakar sir will be teaching us around management of acute appendicitis with modern criteria. So I'm very glad to have you. Actually, we all are glad to have you, sir. And we hope, sir, we'll conduct more events with you in future as well. So, sir, without getting late, I would like to request you to please start the webinar, sir, and give us a plenty of knowledge, sir. Thank you.
Good afternoon, all of you, and thank you, Dr. Jitesh, for the introduction. We all know in lockdown, we try to learn something more. Now, with this advent of corona epidemic, we have seen a lot of thought processes where people are struggling and wanting, say, homeopathy should be on the upfront, and we are trying to see. At the same time, the allopathy is asking proofs from us that whether your medicine is acting, and so on and so forth. Today, we are the topic not being corona, because now we are still in the process of learning and understanding and getting experience. But what I was trying to say here in this case of in this particular webinar where I'll be speaking, I want to speak more about my experience with appendicitis, not for the purpose to show that, okay, how good I am at treating appendicitis, because I feel appendicitis can be treated by everyone. Only thing, there are some inhibitions which we have, some difficulties which we have, some questions which we can have, some of the questions which the patient asks, some of the questions which the foreign, not necessarily foreign, but outsiders, that means the allopaths or other system of medicine would ask query question. So that is the reason why I'm trying to tell my experience with appendicitis and final outcome as what we can do now. Now, that's what I want to try and do that. See, when you are young, when you start doing your medical college, You always think yourself as a person, doctor, and you are going to save lives. And specifically when we are treating cases like acne and headache and all, you are not
Sorry, sir.
actually saving lives.
Sir, sorry
Hello,
to interrupt you. Your voice what a bit disturbed, sir.
is it now
Yes,
better?
sir. Better, better, better. Please go on, sir.
Yeah. Okay. So sorry. So when we become a doctor, what we really want is we want to become saving somebody's life in the true sense, where you say there is a danger to life and we want to save that. Acne,
Sir,
headache, joint
sir, there
pains.
is a problem with voice, sir.
What do I do?
Sir, I think if you speak slow, sir, I think it comes clear. Now it's fine.
Is it better? Is it
Yes,
better?
sir. Is it better now?
Can you hear?
Yes, sir.
Okay, then I will be very quite nearer to the this. No
Yes, sir.
problems. Is this better now?
Yes, sir.
Okay. So when we pass out, we want to save lives, and treating headache and treating joint pains, which we are doing chronic cases, we actually sometimes feel okay. Now, this we are helping people, but saving lives, because that is what every doctor likes to feel about himself, to be a savior. No. So we enjoy, or we like to treat emergencies because there is a sudden state of danger. There is a life and death situation which requires your immediate action, and you have to be the savior. And when we treat such cases, it also helps us to be naturally gives us great satisfaction. But at the same time, it also increases our fame. So these are the things which we want to do. At the same time, the question which comes in our back of our mind: are we good enough to treat that? Can we treat it? Is it medical legal? And so on and so forth. So therefore, when I am trying to say this particular disease, because I have a reason for that, this helped me. And today there are a lot of medical legal hurdles. There are a lot many medical legal cases. Now, when I passed out 35 years ago, medical legal cases were lesser, so that chances were there. But the chance helped me to have a grip on the disease.
Sir. I think sir, you should go slow, sir. Sorry to interrupt you. So basically, what is happening with your mic when you are speaking continuously, the voice is continuously getting cracked. So if you go slow, sir, the cracking noise is not coming up.
Fantastic. I will do that. I
Yes,
will do
thank
that.
you, sir.
Yeah. So let me begin with one case which I saw in the OPD when I was just a beginner, that was as a house physician. So I was lucky enough to get this chance. So this case is of acute appendicitis, youthful exuberance, and it confirmed the therapeutics. So this was a 22-year-old unmarried girl, who was working as a maid, staying nearby. Now we have a slums near our hospital, and this patient came to the OPD of our hospital, which is known as Shri Mumbai Devi Homeopathic Hospital, in August 1985. The date itself shows that it's nearly 35 years ago. She had severe pain in abdomen since 2 days with nausea and vomiting. She also complained of high fever. She was lying still with a lot of agony expressed on her face. This was the presentation. I was not the first physician, it was in the next OPD. And one of my colleagues saw this patient. The honorary or the senior physician was not there at that particular moment. So she came to my OPD, in the OPD where I was working. I was also a junior. She said, "Arey Prabhakar, what do we do? This patient is severe. Jara aake dekh lo. You come and have a look at it." So I went there. When I went there, I said she would not let anyone to touch her because of the pain. The mother said that she had this pain since 2 days and slowly it is growing in severity. And as usual, any mother, how she does, she attributed this is because she is eating outside food. This is a very common phenomena. Every mother tells that. I remember when I had something, it would be attributed for me eating peanuts. So this is a common phenomenon. Temperature was 100 degree Fahrenheit, pulse was 110, respiratory rate was 32, BP was 110 by 70, the palms were warm and dry. Okay. On inspection, the abdomen was scaphoid, no surgical scar, umbilicus was inverted. On palpation, it was warm to touch, tenderness at the McBurney's point, with guarding of the abdominal wall, indicating that definitely there is a pathology inside, and this pathology seemed like appendicitis. She was lying still again, with a lot of agony expressed on her face. The touch aggravated her, but firm, slow pressure made her feel better. Percussion was normal. Auscultation, peristaltic sounds were heard. That means there was no obstruction. That is what it means, that there is no obstruction. On per abdomen examination, when we palpated her, there was rebound tenderness, which is one of the confirmatory sign of appendicitis. Rousing signs was positive, obturator sign was negative, and psoas sign was negative. Now, this definitely all of you can, you all know it, so there is no need for me to talk about it much more. So this was confirming that this patient had appendicitis. Now the question was, what do we do? The senior physician was not there. What do we do? Now I said we will admit the patient. The senior physician was not there, but we admitted the patient into the ward. And when the senior physician came in, she said, "Why did you admit an appendix patient?" So as a student, I was just a junior. No, I said, "Sir, it was taught to us in our therapeutics that there are remedies for appendicitis. This is the patient of appendicitis. We should give." Now see how easy it was. She was saying, "How can we do that? It's serious." I said, "If it is serious and we have remedies which were taught, therefore it has to be applicable. Let us give it." She was a good sport. She said, "Okay, let us see now what happens." What actually happened was that she said, "But you will have to manage the case completely. You have to be there around the patient." I said, "That is my responsibility, because that was my first emergency." Now the excitement of being a doctor and trying to treat a first emergency, so you are definitely much more alert, right? Now what we had learned in the hospital was how to manage the patient of appendicitis conservatively. So there is a particular type of regimen which I will be talking about. On examination, the tongue was thin, white, coating, dry, and she was a hot patient. Okay, so this was the patient was admitted. Now there is something known as Ochsner Sherren regimen. Ochsner Sherren regimen, which was there in the textbook of surgery, and which talks about we have to keep the patient nil by mouth, no food because there is inflammation. A Ryle's tube has to be put, which we don't put it now, but it was put there. IV in case of she vomits and she aspirates, therefore the Ryle's tube is put. IV fluids need to be given because the patient will be nil by mouth, has to be given. The IV fluid, the vein, the scalp which we put is also useful, so that if the patient collapses, we can manage it by giving any medication. That was the understanding. Abdominal girth has to be taken every 4 hourly. Temperature, pulse, respiratory rate, BP has to be taken 1 hourly. Input-output chart has to be maintained. And there is something known as reverse Trendelenburg's position. So now this reverse Trendelenburg's position is where the patient's head side of the bed is kept high, and it is in a slanting position, and the person's pelvis is on a lower angle than the head and the trunk. Now why this is important is that if there is a bursting of appendicitis, it should not spread, the whole peritoneum should not be infected, so there will be localized peritonitis. This was the concept by Ochsner Sherren regimen. Okay. Why TP, BP and all 1 hourly? Because there are stages of inflammation. Now what happens is that normally there are 3 stages of peritonitis. So in the initial stage, there will be pain, but in the second stage of peritonitis, there is no pain. Now that can mislead us to understand that the patient is cured. But if there is a second stage of peritonitis where the patient is painless, because this happens because of lot of peritoneal fluid coming diluting the inflammatory area, and therefore the patient feels relief. But when this happens, the person's pulse rate increases and the BP starts flowing down. Therefore, this TPR BP 1 hourly is important. So if it is standing normal and the patient is pain is less, then you know your remedy is active. But if the BP is falling down and the pulse rate is going up, that means you are making a mistake. The patient is deteriorating. Take consent of the patient. Now the consent is for surgery. Here we also need to take, we are taking the consent of the patient for homeopathic medication. We have explained the thing. If required, the patient can be referred to surgery. This is a additional what we call, which we had an additional insurance, so that in case if surgery is required, we can do that. Shave and prepare the patient. That is again for the surgery, which nowadays we do not do because it is not required. We know we can treat it better, but this was the first case. The remedy which we gave was bryonia, which I think all of you must have come to the conclusion. Here being the patient is lying down still, tenderness, moving aggravates, and pressure ameliorates. This is the common symptom. At the same time, the patient's palms were dry. Bryonia is also known as dryness, so it's dry and hot. So this gave us the idea of giving bryonia. And most of the time of appendix patients, we get this common symptom of shooting or stitching pain, which is better by pressure. And therefore, in many cases, I have treated more than 250 cases of appendix. We are talking about acute appendicitis. And in 90% of the patient, we got it as bryonia, but that should not be just like that. You cannot blindly start giving bryonia because a teacher or somebody told you. You need to take the history, because if there is some characteristic difference, that remedy will give an excellent result. The patient has to feel better within 6 hours. Patient has to feel better within 4 hours. No, that is the power of homeopathy. So within 6 hours, the pain was better by 80%. We continued the IV fluids for 48 hours. And after that, the patient was better and the patient went home. Now, this is the first case. Now, what follows in a series of events in life, that's what I am trying to say here, that when we treated that gave us a lot of confidence, and the doctor told me that you need to look forward what happens in the later on in the stage. The patient can go into chronic appendicitis, etc., etc., etc. That patient followed up, and we followed up the patient for nearly 2 years, and there was no complaint. And then we lost the patient to the follow-up because they shifted somewhere else. The patient had no complaints for the next 2 years. After that, we treated many cases of appendicitis. Now, what happened is that when students listen to this, and when students see, they are impressed, they're happy, they know that homeopathy acts. And we have different OPDs. So by that time, I had become senior, I had my own OPD. So when surgeons said that we have appendicitis which requires surgery, so sometimes the student raises the hands and says, sir, it is not so. We have had patients of appendix and it has been treated by Dr. Devadiga. Now here one question came in, the surgeon said, no, it is not right, it is not fair. How can you treat appendicitis? No, that is a risk. The patient appendix could have burst. And what will happen if the appendix bursts? No. Will he be treating himself or his relatives if he gets such cases? Or at that time he would go to the surgeon and get it operated, or he would want to give antibiotics. This was the question which was put. Now, fortunately, unfortunately, how you look at it, I had this when my son was around 3 months old. I was he was playing in my lap, and suddenly he kicked. Usually, as the children kick, he kicked, and I immediately, reflexly just tapped him hard. I said, and then I thought, thinking, why did I do that? And I found that it was because of the pain which occurred. And then I examined myself. I found it was quite severe pain. I told my wife, no, this seems to be something difficult, because I usually will not be very irritable, or I would not reflexively, no, like tap the child, such a small child. I got myself admitted with my surgeon friend. So he came there, he examined me. He said, Dr. Devadiga, you have got appendicitis, acute appendicitis. We will need to operate. So now I had my chance. I said, as a patient, I know that I need not give my permission to operate. So I will not be signing for operation. So you can write that I refuse surgery. I need conservative line of treatment. Now here he says, no, doctor, you are under me. So conservative line of treatment, I will need to give my line of treatment. I will give you antibiotics. I told him that I am absolutely allergic to antibiotics. You can try at your own risk. He said, no, let me have a look at it. So what he did was he put an IV into me. He started giving Metrogyl, and within seconds, the whole venous tree became visible. You can see that I reacted very badly to this reaction. And since he was there, being an VIP patient as a doctor, so what happened was that when I took this IV fluid, and there was this venous tree which became, he immediately removed it. He said, you are allergic, we can't do this. And if I had given you this medication or any other medication, then it would be problem. So I do not know what to do. I said, why don't you write on the paper that the patient is refusing surgery and he is allergic to allopathic, so homeopathic can be given. So he said, okay, homeopathic you can give. I said, I will prescribe for myself. So I prescribed for myself the remedy, again Prionia, which was there very peculiarly. And within 4 hours rather, I started feeling better very nicely. And this is now 24 years ago. I have no complaints, nothing. So at that particular moment, because it was on record, it was in the record of the hospital that I went, got admitted. And then on the third day, I told him, now examine me and tell me what is the situation. He said, now you do not have any complaint. Your abdomen is fine. So will you write that the patient this acute appendicitis is over? He said, I will write acute appendicitis is now resolved as of now. I said, whatever. So that, the credentials of homeopathy was established, at least within my circle, where okay, even homeopaths can take on themselves this medicine. Then this doctor, being a good friend of mine, he says, no, ऐसे नहीं है. He says, ऐसे नहीं है. No, you have to be careful, because no, the patient can develop abscess, patient can develop this, and sometimes how do you know that this patient will have burst abdomen? He can have burst appendix. So I said, what do you do? Now we are talking about few years ago. So he said, no, if the patients, you can do the CBC, and if the patient's WBC is very high, then it indicates that the patient has got a very turgid appendix and it can burst. So we went through that for some time, and whenever the patient's WBC would be above 15,000, he would say, let me operate. And he operated and he showed that it's a big turgid appendix which was there. And he said this could have burst. And one of the cases we found that it was also turning gangrenous. Though the patient had come after 2 days, but it was gangrenous. His WBC count was more than 25,000. So it was really in a bad shape. So he said, see, we can do this way. Now we are having a combined effort of treating appendicitis. Over a period of time, we came across this Alvarado score. Now, this is very important for us now. That whenever we are seeing a patient of appendix, the pain can begin first in the umbilicus, and then it goes to the right iliac fossa. If it migrates to right iliac fossa, you write it as 1 point. Patient has no appetite, then 1 more point. Nausea and vomiting associated, 1 more point. Right iliac fossa tenderness, you give 2 points. If there is tenderness only in the right iliac fossa. If there is rebound tenderness, that is when you press and when you leave, the pain is very severe. When you press the abdomen, there is some amount of pain, but the moment you suddenly leave it, the pain will be severe, and that is rebound tenderness. That we'll have 1 point. If the patient has temperature, 1 more point. Leukocytosis more than 10,000 is 2 points. And if the neutrophils are high, more than 70%, 1 more point. Total score is 10 points. And initially, when I was combining with, or I was together with the surgeon when we are treating the patient, we said that if it is 7 or less than 7, we will give homeopathy, and more than 7 points, we will give in for surgery. That was the understanding. That is a learning. But then, as time progressed, we found patients who refused, who said that you have treated some other patient of appendicitis. Why would you want to go for surgery? Now they are putting us in a big soup. Okay, no, you don't need to go for surgery. You can, you have treated, so we want you to treat us also. So now that the patient's faith in us, at the same time, the dilemma that if he takes such decisions, it can be harmful to the patient. So I had an experience of another case where the patient came in and said, no, I do not want to go in for surgery. And his leukocytosis was around 19,000. So his total score was 9 points. Okay. Now, with 9 points, it is definitely surgery. I called the surgeon. He said, now you have given him nil by mouth. He is there tomorrow morning. I will come and operate him. So let him be nil by mouth. And we will have a look. And you carry with the homeopathic medicine. I'll come tomorrow and operate him because he requires surgery. That was what the concept was. In the morning, I got the CBC done again in 6 hours. No, not nearly 6 to 8 hours. The WBC count had come to normal. Patient was sitting in the ward. After I had given this medicine, after 1 hour when I came, he was sitting and talking to his wife. No, he was talking about his business on mobile phone. So you can see the response time had improved. Now we could see the response even within 1 hour. Similarly, there was another patient who came to the OPD. I will be showing a CT scan later on. So he came to the OPD. He says, doctor, I have got severe pain. Something I ate outside, so I'm not very sure, but I can't move. It's very severe. And he was bending forward and walking. I examined him. On examination, severe tenderness, right iliac fossa tenderness. I said, boss, you have got appendicitis. You need to be admitted. He said, okay, doctor, I will get admitted. I will go home and then take my belongings and I will get admitted because I have not brought anything. I have not brought much money also to be given in the hospital. So the pain was severe. It had a lot of irritability was there. No, this patient had a different symptom. Irritability was there. He find it difficult to move. But for everything, you would normally, a very genial person who would get angry, snap at his wife if he was with her. You don't understand what type of pain I have. So there was this difference. So I gave him Noxomica. I said, you get admitted and then we will see. We will ask the surgeon to come in. Now the interesting part is, by the time I finished my OPD, I went home. I went to the hospital, not home. I went to the hospital. He had got admitted. And he says, doctor, the medicine which I had taken, well, by the time I reached home, I was better in the pain by 30%. And since you have told me to get admitted, I got admitted, and now here I am. So now what to do? So I called my surgeon friend. He says, no, doc, you do a CT scan. I know that you will not allow surgery. You do a CT scan. So we did the CT scan, and I will show the report later on. So there is one more test which will now be coming in the market, and some places it is done. What is known as matrix metalloproteinase test, MMP levels. Now this will give a guideline whether this patient will have a burst appendix or not. So perforated appendix is seen in patients whose MMP 1 and 9 is raised. MMP 1 is raised in gangrenous patients, and in patients MMP 9. But now they have come with a newer one. What they have said it is better is known as MMP 8. You can look it up in the website, in the Google, and you will find that it can be done in some places. You can do that. If it is on the higher level, definitely the person requires surgery because you cannot take that risk. That's what the understanding is as of today. So what we did we understood in that patient who came, just a minute, sorry, all of you can see this. This is the CT abdomen. I have taken the permission from the patient, therefore his name is also put there. And if you see that it's written very clearly in CT abdomen, 13th January, when this patient had come with severe pain. Plain shows appendix is pelvic in position. Evidence of acute appendicitis is seen in the form of thickening and accentuated enhancement of walls and increase in diameter of appendix with surrounding fat strand and inflammatory exudates. Adjoining distal ileal wall edema is seen. Okay, no abscess and no peritoneal fluid because it is an acute thing. Now, what happens is that this gentleman, the radiologist, will phone up and say, "Doctor, this is he will require surgery." I said, "We doesn't require surgery. We will manage it without surgery." "No, doctor, it is there." "No, so you can't take such risk. There is a proof that there is appendicitis." I said, "That is what exactly I require. No, I require proof that there is appendix. No." You can see that the same thing is repeated again in the opinion and referred in below report with compliments to Dr. Prabhakar Devadiga. So now we are directly treating the cases, not sending it through the physician surgeon. So this is what the report says. The patient was better within the next 2 days. Now, when the surgeon went there, when the surgeon came, I always give a reference to the surgeon. I always make this habit. As I told you, one has to be confident but not overconfident. The surgeon has to be there. There has to be a team with you. There is a backup team. Surgeon came there. He says to the patient, "I know your doctor must have told you that he will treat you homeopathically, but as a surgeon, I need to tell you a few things." Now, this is the interesting part of it. That's why I'm trying to tell you how the mindset and how the thinking goes, and that can create. He says, "You might be all right with the medicine because it's an acute disease. Acute disease, as I understood, can go, it can resolve, but the obstruction remains, and you will require surgery at a later time. So you feel free whenever you want to, and at present you will not have anything to eat. And if the pain increases, then we will operate you." He had the grace to tell that no, you start with the homeopathic medication. So this is the first point which he now allows for the homeopaths. But at the same time, some more point is told that the inflammation remains. And the patient will have an option of getting this recurrent appendicitis because it is not fully treated. Means appendix is not removed. Now that is what the concept is. Now we'll go back to the CT scan. This CT scan was done on 13th January. Now let us see. I asked the patient to do the CT scan later on. I said we'll wait for 6 weeks and then we will see the CT scan whether the inflammation and chronic inflammation remains. Now you can see this done on 14th March. The patient delayed it a bit, but doesn't matter. Now you see same patient 14th March. Appendix is pelvic in position. Appendix exhibits presence of normal physiological air in the appendix lumen and opacification of lumen by oral contrast. Now this is very important. Many times our appendix is not visualized when we used to do barium meal. Yeah, so they used to say that because the appendix is not visualized, it has to be operated. Okay, now your air is there. That means now because whenever there is an appendicitis, there is fluid filled in the appendicular lumen. So you cannot see the appendicular lumen, and they say since the appendix is not visualized, it needs to be operated. Now here you can see that after the homeopathic medication, the physiological air is normal, physiological. No wall thickening, no surrounding fat stranding is seen. And if you see the final conclusion, because we send this CT scan for comparison. So here, previous images are not available for comparison. Previous printed CT report, given by the same person, mind you. Appendix is pelvic in position. Appendix exhibits presence of normal air, and as compared to previous CT report, there is resolution of appendix inflammation. Now that is a final and final report of a patient getting completely all right. I hope I am very clear in my voice and understanding. So now we know that we can treat acute appendicitis if the Alvarado score is less than 8. I have treated case of 9, but that need not be always the case. We cannot be, unless we have many cases, we cannot be very sure of that. The leukocytes are less than 15,000. The duration is more than 48 hours. You can safely prescribe, because by then you can definitely understand this is subacute appendicitis unless the leukocytes are high. The signs of generalized peritonitis is not set in, you can definitely treat. If there is no sepsis, if the patient is in a collapsed condition and he has appendicitis, don't try to treat it, because then it is a mess. The patient will require ICU management. And you can be very sure now, within 3 hours, if the patient has got positive response, you know that your remedy is right. You don't need to bother about it. You can sleep easy. This is what I would like you to understand. But I want to say something more now. More than 1 million cases of appendicitis are there, and it is a commonest non-elective surgery. When homeopathy is given, it acts better and faster than the existing conservative treatment for appendicitis. Like, for example, if the patient has been given antibiotics, it takes more than 5 to 7 days for the person to be completely all right. And here we see the next day the patient is much, much better. Many a times he is 100% better. We usually keep, if the patient is admitted, we usually keep the patient in the ward for 3 days. Now, many a times I have seen I have not admitted the patient and I have treated
Sorry,
T level
sorry,
also.
sir. Sorry, sir.
Again,
Yes, sir. Yes, sir. You need to be slow, sir. Very
okay.
slow. Very slow.
Is this
Sorry,
better?
sir. But I think there is a technical with your mic, sir.
Okay.
Yes, sir.
No, but
Like,
all the up to now, were you able to hear?
yes, sir. I think takeaway message should be
Hello.
repeated again, sir.
I will do that.
Okay, sir. Thank you, sir.
Yeah. I think there was some problem in voice. So I will repeat it. Is my voice clearer now?
Yes, sir. If you are slow, sir, it is very nice.
Okay, I think I was fast again. I was taken away by the takeaway message. Anyway, so the takeaway message I would like to tell you all, friends, is that we can treat acute appendicitis if the Alvarado score is less than 8. This Alvarado score you can download from the websites. It is available everywhere. The leukocytes or the WBC is less than 15,000. The duration is more than 48 hours. The signs of generalized peritonitis is not set in. There is absence of sepsis. If sepsis is there, you need a ICU management. Therefore, you have to be very careful. How do we come to know there is sepsis? If the patient's pulse rate is very high, the person is not speaking, the person's temperature is there, he is really in a state where he is not responding, then this is sepsis. We need not try to treat this patient. And the WBC count also will be very high. So such patients should be avoided. And when you have started treating, and if you are given a remedy, if the response within 3 hours you get, usually in acute appendicitis, you get the result immediately. Let me tell you this. But you can wait till 3 hours. If the response is there, you know your remedy is acting. You don't need to change the remedy. And you know that it is going to cure that person completely. The dosages in cases of acute appendicitis, initially I used to be worried and I would give very frequently. Nowadays, single dose also helps. I feel when dosage is our confidence. Once we are very confident, single dose also helps. When we are not confident, we repeat. But in acute disease, the advantage is that the patient will tell you, and you are supposed to follow that patient. So you can follow up that patient. So you can phone the patient, ask the patient, and ask the patient to call you back after an hour and so, how does the patient feels? Nowadays, sometimes quite a number of doctors make the patient wait in the clinic itself and say, "Let me know what happens after a few minutes." So homeopathy can be judged that way. By within few minutes, in a few hours, we can come to know our remedy is active. It is acting on the basis of the sentient nerves faculty, which is there, faculty of sentient nerves everywhere in the body. That's what is written in Organon and is a fact. More than 1 million cases per year of appendicitis is seen in the world. 1 million is a big amount, big number. And commonest elective surgery, non-elective surgery, meaning where there is the operation is emergency. One of the commonest emergency surgery is appendicectomy. Homeopathy acts better and faster than existing conservative treatment for appendicitis. This is what I want to say, and I want to say something more. This I talked about, this we showed. The question is, why not surgery? Now, there are a lot many reasons for not doing surgery. Newer studies have shown that increased prevalence of Parkinsonism is 3 times higher in patients who have got appendicectomy than patients who have not got appendicectomy. Now, how is it possible? Appendix and Parkinsonism. Parkinsonism is there in the somewhere in the midbrain. Okay. There is a dark pigmented thing in the brain. Yeah. And in that, there are some chemicals which are responsible for Parkinsonism. But they found that the similar things are found in the gut, especially in the appendix, which is inhibiting those enzymes. And if it is removed, it is possible. It is possible. There are two questions, because there are some people who say that appendicitis by itself is the reason why Parkinsonism is occurring. That's how they have started counteracting that. So it's a debatable thing. From 2016 onwards, the debate is going on. A lot of research is being done. There are people who have seen 8 lakh cases, and no, they are still shifting the data. But latest, what they have written is 3.19 times the risk of developing Parkinsonism is more than those who had not had surgical procedure. The moment people follow up the patients treated with homeopathy who has not had appendicectomy but had appendicitis and did not get Parkinsonism, will definitely prove that appendicectomy is bad. That is one. Okay, and they have found that the risk of developing Parkinson's disease was similar in all age groups, regardless of gender and ethnicity, in relation to appendicectomy. Yeah, in relation to appendicectomy, this is a part of that, which I have. You can check it in the Google, you will find this. And next thing is, there's one more article by Patricia Inacio who writes, appendicectomy raises risk of lupus, especially in younger women. And this again, you can go through this, you can read about this, so you can understand that appendicectomy is not just a simple appendicectomy, because this falls under what we would now say it is a, what we would now call it as a surgical suppression. Okay. So how do we document it? It's very important that we document. So we require patient's case history proper and thorough. It has to be documented. Alvarado score has to be maintained every 6 hours, 8 hours. So no, we get an idea how the shift is occurring. So no, more studies can be done. We are now in the process of doing that. Though I had treated 200 cases, initially it was the happiness of treating appendicitis, then trying to disprove the allopathic doctors, then trying that we are better. But now, if you really want to do a proper research, we need to do this. So now we are collecting such data. Quite a number of patients we have collected the data, but we need some more cases. So patient's case history, Alvarado score, CBC has to be done. Sonography will help in places where CT scan abdomen is not available, but CT scan abdomen actually gives a proper result, and it is not now questioned by the allopaths. So this is what I wanted to tell. Some of the remedies which are commonly, as I told you, told you Bryonia is the common remedy, but then in very acute pain, very severe pain, and there is a lot of congestion. The pain comes in severe. The patient even cannot the patient cannot tolerate any jerk. Then belladonna will be there. Now, my teachers have always told me that belladonna is very good drug, but we have to be very careful. What he said, one of my teacher, Dr. S.K. Goel, told me that if you give belladonna in cases of acute appendicitis, the chances of perforations are higher. So he gave me an alternative. He said in such cases when belladonna is indicated, think of plumbum met. So I had given plumbum met in 2 cases where belladonna was, and it was a good result. But then these are individual experiences. You will have to go through that. So cannot really tell with 2 cases. But plumbum met we have given when the patient had developed some amount of intestinal obstruction, or there was no adynamic obstruction, the patient had not passed stool, and peculiar pain which goes from front to the back. Especially in cases where the appendix has got nearly 8 positions in our body, normal positions. So if the appendix is behind, and the pain radiates to the back, normal appendix is retrocecal, but sometimes it can also go behind. And then this pain, when the patient gets a pain in the back, plumbum met is one of the indicated medicine. Nux vomica, as I told you, that when the patient's irritability overcomes that. But 90% of the patient, what we have given is bryonia. This is what I needed to say about appendicitis. Advice to the patient after treating the patient in acute appendicitis to maintain proper diet and regimen. It is usual because I had some cases which did not do well after the treatment. What they did was the moment they were all right, they started having an improper diet. In that sense, 2 things. One is not eating on proper time, and second, eating outside food immediately, because 4 days he was admitted in the hospital. He wanted to go out and have fun. So that is where the problem occurs. Hope I could help you understand about this topic. I am open to any questions which you have.
Yes, sir. Thank you, sir. It was a wonderful session, and we really enjoyed learning. It was a great cases. And sir, now the questions. Sir, Dr. Anaga Mahajan has asked for how long we need to continue Bryonia.
Now, usually when you give the medicine and the patient becomes painless, the bryonia has to be discontinued. Because our over enthusiasm in trying to prescribe it, tend to prescribe more. So the moment the patient is more than 80% better, bryonia can be discontinued. And in some cases, very sensitive patient, one single dose also cures the patient.
So Dr. Hussain,
So dosage is decided by the patient.
Okay, sir. So Dr. Hussain has asked, acute appendicitis case, Bryonia 200 hourly, should we alter the dose at successive attempts, or the same dry dose of Bryonia 200 will be given every time?
Initially, a few years ago, when I was giving dry dosages, we used to give dry dosages, but giving altering doses also helps, and it is really helping. So altered dosage or deviated dose is better. So you can give in liquid form. Now, the problem is that when you are keeping the patient nil by mouth, it is better to give in dry dose. We are contradicting that. If you have to give in a liquid dose, then you are giving, you are not keeping the person nil by mouth. Our pills can be sucked on, but liquid has to be swallowed. Then the nil by mouth concept goes away.
So there is a question by Dr. Faiza. Sir, do the scores shift and we need to check every day?
Yeah, it needs to be checked every 12 hours because we have seen the shift. Like within 12 hours, your WBC count goes down. That is the beauty of homeopathy. within 12 hours. You can check it now. Number of cases we have done. Previously, we used to do after 24 hours. But now you can see the inflammation, which was 19,000, 20,000, it comes back to normal. So you can imagine how fast. The whole idea today is not trying to say that homeopathy acts. That time is gone. After 200 years, we do not want to prove to the world homeopathy acts. What we want to prove that it is acting consistently, and we can prove pathologically with evidence. That is the whole concept. Young people should understand that.
Excellent, sir. Sir, Dr. Giridhar Kumar has asked, explain about potency, sir.
The potency, usually what we give is 200 because it is by rote, but it is not compulsory. We have given 1M also. Acute disease, 1M is also useful. Now, we have also treated some cases with 50 millisiemen, 0/1. If you have, you can prescribe by 0/1. We are not done at the comparative study of all the potencies. We will be doing that. When more cases will be there, we'll be doing that too.
So, Dr. Ashish Tiwari has asked, what is your view for Irish 10x?
Irish 10x is a good remedy. Irish 10x I usually give when there is an abscess formation or if there is a lump formation in subacute appendicitis. Irish 10x and radium brome are the two remedies which are helpful at that particular time.
So, Dr.
Rather than
Sita...
acute. In acute,
yes, sir.
yeah,
So
in acute appendicitis, I have not given Irish 10x, but I have given Irish 10x in for resolution of appendicular lump. Usually, when a patient has appendix and not treated properly, he gets an appendicular lump. That gets completely resolved with CT scan finding. It gets completely resolved, and there is a normal appendix after that. Usually, it doesn't happen. People have to go for surgery. So, Irish 10x is very useful there. So is radium brome.
So next question,
Yeah.
Dr. Sheetal, do we give constitutional remedy after the acute episode?
Yeah, that is the requirement for any patient who is come with acute disease. It is if the patient comes back to you, yes, you need to take the full case, because what will you do next time when the patient comes to you? So you take the history and then you can give the person a constitutional remedy if it comes up. There are times when the patient does not come back because they're all right. They did not feel the need for going to the doctor. So if the patient comes back, you can give.
So another question, Dr. Utsav, in any case, patient required more than 2 remedies?
At a time? No. No, we have not had a requirement of a change of remedy up now. Acute disease has this peculiarity that they will throw up characteristic symptoms. So change of remedy has not been required up to now. Touch wood, maybe someday I might be proved wrong.
So any other medicines you used in your practice? Dr. Rahul Patel is asking.
Yeah. Hello.
Yes, sir.
Any other question?
Yes, sir. There are many. What Dr. Sunita is asking, what is the protocol of IV fluids?
Protocol of IV fluid in a patient is nil by mouth. Normally, at least 3 pints should go in, because if he is nil by mouth. So some people say 2 or 3 pints, and there are some surgeons who give 4 pints. And the protocol is that you are supposed to begin with, first is dextrose saline, for the simple reason, because if you start directly with 5% dextrose, the patient's nausea will increase. So dextrose saline reduces this problem of nausea, which begins with when we give 5% dextrose, and then 5% dextrose, and then if the patient had a lot of vomiting and all, then ringer lactate has to be given.
So Dr. Sharmishta is asking, can we use Macfos to reduce the pain relieved by pressure? And it's a biochemic medicine.
Biochemic medicine I have not used, but you can give it if the patient is reduced by pressure. But when we have bryonia, which helps much better, why do we need Macfos? Macfos will be there when the patient says, I need a hot water bag, and feels better along with this. Macfos has both amelioration by pressure as well as hot water, while bryonia patient does not like hot water fermentation.
So another question, Dr. Mandeep, what about lycopodium?
If it is indicated, can be given. If it is indicated, definitely it has to be given.
So Dr. Sunita is asking how to differentiate between iris and radium bromide. I think iris 10x.
Radium brom. Iris 10x and radium brom.
Yes, sir.
The type of pain, if you see, iris 10x and radium brom are different. If you read from the book, I'm not going to tell you just now because some homework I usually like to give to everybody. That's my way of going about it. So they are different, the type of pain. Radium brom, the pain is better by motion. So iris 10x is just opposite. That is what I usually differentiate iris 10x and radium brom. With the modality.
So another question, Dr. Hitrat Mehta, what is the role of miasm in this case study and how, sir, you correlate with acute appendicitis?
Now that's a big question because miasm, when Hahnemann talked about miasm, he wanted to make you understand that the recurrence which occurs should be prevented by giving a proper anti-miasmatic remedy. And that's what I told you, that when we give constitutional remedy, you are giving anti-miasmatic remedy. So there is no separate thing like a anti-miasmatic remedy and a constitutional remedy. The constitutional is an anti-miasmatic remedy. So the patient should not have a recurrence, therefore you can give anti-miasmatic remedy, provided the patient comes back to you for it. Usually, quite a number of patients who have got this acute complaint, they do not come back, they're all right. And when they come back, they have something else, then we are giving them. Nowadays, we are insisting the patient that you should need to follow up at least for 6 weeks. Now, with this new idea, it is very helpful where we want to do the CT scan. So, no, I try to use this for our advantage. When the surgeons say you will have a chance of getting chronic appendicitis, very good. आपको 6 महीने 6 हफ्ते बाद वापस you have to do the CT scan. So, it will be helpful. So by that time, when he is coming for 6 weeks, he has to be given something. The constitutional is automatically given. So I basically do not feel that there has to be a separate miasmatic remedy to be given. The acute disease, psoric manifestation, and whatever the constitutional comes up has to be given.
So another question, Dr. Mahesh is asking, Doctor, how can we alter or treat the abscess formation in appendicitis with homeopathy?
You can treat like any other case. In patient who has got appendicular abscess, I had only 3 cases, not many, because most of the patients were all right. Only 3 patients who were treated somewhere else with maybe allopathic or not treated. Such patients had come with appendicular abscess, where the surgeon said we'll need to operate, but the patients were not operated and the abscess is completely absorbed. No. In such cases, if it is not a very acute condition, then the full case taking will give us the individualizing report, individualizing remedy, and you prescribe whatever is indicated. In one case where the pain was quite severe, we had given the patient heparsulf and the patient, the abscess got absorbed within a matter of 1 week. There the patient was given heparsulf 1 m for absorption of appendix. I have not given heparsulf 30 because that has chance of bursting it.
So one last question I'll take. Dr. Sunita Agarwal, what is the role of nosodes?
If indicated, has to be given, because in acute appendicitis, nosodes, usually we have 2 ways of prescribing. One, when we prescribe when it is indicated, like any other homeopathic remedy. Second is that when there is a block to the disease, cure. So when there is no block, the question of giving a nosode as a nosode doesn't come in, because we are treating acute appendicitis. In a chronic appendicitis, maybe when it is indicated, we can give some nosode. I have not given any nosode in cases of acute appendicitis.
Thank you, sir. Thank you, sir. Sir, can I post your email ID? There are a lot of queries.
Yeah,
So they
please.
can communicate you directly. Thank you, sir.
They can, definitely. Everybody is welcome. They can.
So to every participants, I have posted the email ID of sir in the chat box. You have any queries, you can ask directly to sir. So thank you, sir. Thank you
Very
for
much.
being us. It was so informative, and thank you allowing us and giving your precious times. And I know you are so busy in COVID patients. So really thank you.
It was my pleasure, Dr. Jitesh.
Thank you,
And
sir.
all the best to Dr. Chiraag. Okay.
Thank you, sir.
Please carry on.
Thank you,
All
sir.
the best to
Thank you,
all
sir.
of you. Happy practice, homeopathic practice. I wish all of you do very well in life. Thank you very much.
Thank you, sir. So, our second speaker is here, Dr. Chiraag Shah. He is from Bombay as well. He will be speaking about integrated approach in musculoskeletal disorders. So let me tell you about him. Dr. Chiraag Shah is a second generation homeopath who runs two clinics in Mumbai in under the name of Freedom Eye Clinic. And the foundation treatment of Freedom Eye Clinic is harnessing nature's healing technology, which is achieved by integrating a host of natural healing disciplines to help treat and heal people, ranging from common cold to cancer. He has mainly trained under his father, Dr. Mayank Shah, he's an MD homeopath, in the art of integrating multiple healing disciplines and also under various homeopaths, orthopedics, acupuncturists to create a vast tool of experience over the last 8 years. So, Dr. Chirag's specialty lies in treating bone and joint disorders, chronic conditions like migraine, hormonal disorders, diabetes, asthma, through an integration of homeopathy, acupuncture, healing diet, healing exercise, and a unique treatment developed at Freedom Eye Clinic called as mind therapy. So, Dr. Chirag, we are very, very excited to learn from you.
Thank you.
So,
So, can I
thank you.
start?
Yes, yes, please start, sir.
All right, all right. So, hello everyone. This is a good way to spend a Sunday afternoon. So, let's go through the most common symptom that we encounter as any doctor, be it a homeopath, be it an allopath. These are the symptoms you will encounter in your practice almost on a daily basis. Pain forms a majority of our practice, and today I'm going to try and give you all an outlook. I'm trying to push you all to think laterally about how you can manage pain in a more integrated manner. So let's broadly categorize pain and let's see where it goes. So the first category is indispositions. What do I mean by indispositions is simply your posture, simply your lifestyle. The most commonest reason for neck pain or lower back pain is people sitting in the office throughout the day without any movement and just working on the laptops. How many of you all get such kind of people? It's quite common, right? So this is not an illness, but it is an indisposition where you are not taking care of your posture or you are not maintaining a healthy lifestyle. The second category, which we can understand, is about injuries and strains or sprains. Now, this in itself is self explanatory. But
So,
sometimes what happens,
Sorry, Chirag.
yeah,
Sir, can you just turn the camera off, sir, from your side?
Okay, sir.
Prabhakar, sir.
I will do that.
Yes. Thank you, sir.
Okay.
audio is good, Jitesh?
Pretty good.
All right. So, the second category, which I was mentioning, is injuries, strains, sprains. Now, the commonest example which we know of is ankle sprains or elbow sprains or wrist sprains or even a sudden acute low back pain where you suddenly lifted something and you got a catch. That's how you would describe an injury or a strain or a sprain. Now, the third category is unique in the sense that we have got something called as metabolic joint pains. What I mean by this is conditions like gout, which is caused by uric acid. Now, why do I call uric acid a metabolic disorder and not another category of arthritis? Is because uric acid is processed in the liver. And if it is not processed well and if it is circulating in the blood, it tends to deposit. So, for me, it falls under a metabolic category rather than purely arthritis. The second thing about metabolic disorders is that you are unable to absorb nutrition well. Like, for example, vitamin D deficiencies are rampant, calcium deficiency is rampant, B12 deficiency is rampant. And what are the signs and symptoms that you would develop because of those? For example, chondromalacia patella. Why do we lose calcium from a healthy part of our body at a very young age? Why does it especially happen in women? Because it is a metabolic disorder where calcium is not being processed well. And the third is also you can think of as calcium deposits in the bones, in the joints. For example, a calcific tendinitis of the shoulder, a rotator cuff tendinitis because of a calcific deposit, or again, a uric acid crystal. So these are the categories of metabolic disorders. The fourth, and for which homeopathy is very effective, as all of us know, is autoimmune disorders. It includes the entire spectrum of rheumatism, rheumatoid arthritis, ankylosing spondylitis, seronegative kinds of arthritis, and many, many more. And lastly, the fifth one is degenerative or age linked or due to wear and tear, like we see in athletes or people who are under high physical strain. So, whenever a patient approaches you, try to evaluate the category in which he falls. Because once you do that, you know exactly what you need to do to help him get out of it. And the approach, mind you, is not the same in every category. Like, for example, if there is a metabolic issue, can you permanently help the patient without changing his diet? Just ask yourself. Let us move on. And when we talk about joint pains, what we need to know is first of all the history and mode of injury. So, for example, if a person comes to you and he said, "Doctor, I have pain. I just fell down on my elbow, or I fell down on my back, or I fell down and I twisted my ankle." You need to know how exactly the joint has turned in order to determine what is your next step. For example, do you need to bend it? Do you need to bend the joint for an X-ray immediately, or can you wait? Secondly, how do you examine? And what are the criteria that you must use to examine? That is swelling, tenderness, redness, the range of movement, and the modalities which the patient has at that point of time. I would suggest each and every one of you please brush up on your examination skills, because many doctors just assume that these things are happening to patients without even touching the patient. Examine your patient, it will build a lot of confidence and create a better rapport in your treatment. And after that, we come to the blood investigations, if required, like uric acid reports, rheumatism reports, thyroid reports, antibody reports, all of those, vitamin reports, whatever you wish, you investigate it and only then proceed. The fourth one, that is radiology, I would specifically like to emphasize that most of us just read reports. Start seeing the plates. Start seeing the x-rays and understand what is actually happening in the joint. Start seeing MRIs and try and understand what is happening in the spine or in the brain or in the knee, because that will give you a clearer picture. Now, this is a clinical tip which I have learned from my father. We treat a lot of sciatica, a lot of cervical spondylitis. And the most common reason for these symptoms to develop is something called as loss of lordosis. I hope most of you all are familiar with this, loss of lordosis. It just means that the spine has straightened out. And when your spine straightens out, it creates a back pressure on the disc, which then creates a back pressure on the nerve, which creates your symptom of neuralgia or radiation or numbness or tingling or heaviness. So now when you think, unless and until you correct the loss of lordosis, are you really treating a cervical spondylitis? Are you really treating a lumbar spondylitis? Are you really treating a sciatica? Yes, you are. But are you taking all the steps that are necessary? Fifth, And something which is very important at our clinic is the nutritional state of the patient. You should inquire about their diet. What are the usual foods they consume? What is the usual fluid intake that they have? Because that determines a lot of our treatments in chronic conditions. Six is also you can inquire about their exercise regimen. You know, there are people at 50 who hit the gym every day and do weights. Is it recommended? Some would argue yes, you can do it at any age. But in my opinion, you should exercise according to your age. And seven, I have mentioned is quality of rest, not quantity. Don't measure your rest in the hours that you sleep, but how well you rest in those hours is what matters more. Keep these pointers in mind whenever a patient of pain comes to you. Categorize him, examine him. That will give us a very good idea of what we need to do and leaves very little to guesswork. Now, let us begin with a case. And through this case, I wish to expand a horizon of treatment. Usually, as homeopaths, we are ready to just prescribe a remedy. We just want to come to the simillimum. And prescribing that remedy and seeing the result is all that we usually think of. But through this case, I wish to change that process a bit. So this is a case of a 24-year-old girl. She was suffering from 2 years with a severe cervical pain. But just before I show you the symptoms, I would like to describe this girl a little. As she walked in, she had an anxious look on her face. Her appearance was very thin. She was looking weak, as if she had not eaten for days. So as she sat down, and before she started narrating her symptoms, there was just one thing I told her. I said, start from the absolute beginning. Don't tell me what treatments you have taken till now. Just tell me from the point where your symptoms started. So this is what she said, that it gradually built up to a point where I had occipital pain radiating to both my trapezius muscles, that is usually these, which we call the trapezius muscle. And because of that, also I feel it radiating down to my fingers and also between my shoulder blades, that is between the scapula. There is a sensation of numbness and also heaviness, and she cannot write a little bit more than normal. Now, pain increases to such an extent sometimes that she is unable to hold her head. And how she describes her pain is as if it's caught in the lower back, as if it's caught in the neck, it's caught between my scapulae. And it extends down, the lower back pain extends all the way down to her calves. Sometimes she says the pain becomes so intense on the slightest exertion that she needs to sleep for at least 2 to 3 hours just to be able to function. Now, just thinking of these complaints, what sort of diagnosis comes to your mind? I would appreciate if some of you could type in on the chat box. What would you think is the diagnosis in this case? Okay, I'll wait for those. And in the meanwhile, there are some associated complaints as well, like a drained out feeling, a complete lack of energy, a lack of focus. She loves working, but she said, I cannot focus on my work. And because of that, she said, I'm also very forgetful, especially when I'm in pain. And the sternal region feels hollow or painful. All right, we'll go to the generals. The thirst is average, about 1 liter a day. Appetite is poor, as could be seen physically also. The bowel movements, occasionally constipated. And one last thing I always ask is the menstrual history. That has to be done. She said, my cycle comes every 2 months. And there is a normal flow for 4 to 5 days, Flow is scanty with a little bit of cramps. Now, as most of you all are writing here, yes, cervical radiculopathy is the first thing that comes to mind. But there is one more thing, the mind space. Anxiety was the predominant feature of her entire appearance and her entire conversation. When I asked her in detail, she said, I'm constantly worried about what is going to happen, about others' opinion about me, about my progress. What am I doing in my profession as compared to my peers? They are way ahead of me and I can't cope up. About not being able to finish her work on time. And of course, about her own health. So this anxiety was so evident that you could see a trembling in her voice. You could literally hear it. She wants to work, but the very idea of work makes her feel tired, creates anxiety and a sense of hollowness in the head. And of course, anxiety and restlessness go hand in hand. The last one prominent feature that came up in her mind space was that she cannot tolerate fights. She wants to avoid any uncomfortable environment and would clearly run away from that. So, this is the X-ray of the patient. Just try and zoom it on your screens if you all can and tell me what can you all see. Is there a name for this? Is there a name for this kind of spine? Note it down. I think we'll take it up in the end. It's very interesting. So when you think about it, yes, all of y'all are right. Cervical spondylitis does come to mind. But in my mind, what didn't fit was her tiredness. For a 24-year-old girl to be so tired is something which is not matching. So what do we do? The other investigations that I did in the case, we did the rheumatic profile. Everything was normal. Anti-CCP, ANA, RA titer, all levels, CRP was within normal range, except hemoglobin, which was slightly low, around 9.5. Her thyroid was normal. Her vitamins, D3, was a little bit low. 20.3 is not too low. Maybe 10, yes, I would be concerned about 10 showing such kind of pains and tiredness. And B12 was 287, which is almost normal. So what do you all think? Is it only spondylitis or is there something else? It's very interesting to understand this. And then I asked her, what all treatments have you done? She said, I've gone through a host of allopathics and orthopedics. I've gone to at least 3 homeopaths. I have done physiotherapy. I have taken all my supplements. I try and exercise as much as I can, but this pain doesn't go away. My tiredness doesn't go away. What do you all think? So there is a very interesting diagnosis which came here. Sleep was unrestful. She could not sleep well. She would wake up tired every day. So the diagnosis I came to was fibromyalgia. Just let it sink in for a bit. Why did I jump to this? Yes, I agree there was loss of lordosis at a lot of spaces, but there was no reason for that loss of lordosis. It was just muscular strain in her entire body. So as you can read fibromyalgia, I read it from Harrison's. It says chronic widespread musculoskeletal pain and tenderness. And the most common neuropsychological symptoms of fatigue, unrefreshing sleep, anxiety, and depression. So now from a simple cervical spondylitis, we are coming to something called as fibromyalgia. Now, here is where we are talking about the approach. Every condition is multifactorial, as in there are a lot of factors. Like I said in the beginning, physical examination, nutritional state, quality of rest, exercise regimen, everything is important. So when you see every condition through these factors, you can design your treatment for your patient, suited to him. So every condition is multifactorial and so is the treatment. Break it down in your mind. Write it down on paper what all you need to change. So as part of the treatment, there are four aspects which we look at. One is a dynamic treatment. What do I mean by dynamic treatment? Is all dynamic energy sciences, that is homeopathy, acupuncture, that is traditional Chinese medicine, Ayurveda to some extent, bark flower medicines, all these come under the umbrella of dynamic medicines. Second aspect we look at is what are the physical changes that we need to bring about in this patient. The exercise regimen, of course, needs to be changed, but apart from that, she needs to have a regimen to relax. Also, what can you supplement physically in the form of medication? So this is where I would also use tissue salts or mother tinctures. The third aspect is nutritional. I have a small quiz for you all. If you all can tell me one food which helps you relax, which calms you down, which induces sleep, one food item, all right, I will surely send you a prize to the first one who answers correctly. So nutrition for us is dependent on finding the right element which is required to be supplemented in the body. Now, simply think about stiffness, think about muscle stiffness, and what is the first element which comes to your mind which is required to maintain flexibility of your muscles? Magnesium, phosphorus, to some extent both. So simply nutritionally substituting magnesium and phosphorus, giving this patient foods which are rich in magnesium, like walnuts, like sprouts, like phosphorus is also rich in banana, true, but banana is not the superfood which I'm talking about. And the last and the most important aspect is how do you help her mind state? Do you think medicine can do it all for everyone? Or do you think sometimes our medicine also needs a push? Just think of this. You need an environment in which you can flourish. What if you gave a medicine in the right environment? What would it change? How would it change your treatment? So that is where we have created a special therapy at our clinic, which we call as mind therapy. So let me take you forward what I did for this patient and what are basically the rubrics that I saw. So as you can see, anxiety was a predominant factor. Anxiety from prolonged ailments from prolonged anxiety, in general ailments from anxiety, anxiety from mental exertion, difficult to concentrate, impossible to study, impossible to work, and a host of fears. Not only this, but I also looked up about her physical complaints. And this is what came up. Pain in the cervical region, extending to the head, to the occiput, pain in the dorsal region between the scapulae, pain in the lumbar region, and also there are other rubrics which say that they are extending down into the arms. There is heaviness, numbness, tingling, but I can go on and on to put rubrics in front of you. Any guesses which remedy this is? So my prescription was picric acid 30. Picric acid is a fantastic remedy for fatigue and brain fag. And I have been introduced to this medicine because of my father. He has used it a lot over his years in cases of chronic fatigue and also stubborn cases of spondylitis. I'll just read something out for all of you. This is from Borix Materia Medica. It says brain fag acts upon the generative organs through the lumbar centers. There is prostration, weakness, and pain of back. Pins and needle sensations in the extremities. Muscular debility, heavy, tired feeling, progressive pernicious anemia, writer's palsy. So this is just the general section in Borix. And if you read specifically in the mind, it says there is a lack of willpower and she is disinclined to work. In the extremities, it says great weakness, tired, heavy feeling all over the body, especially limbs, worse exertion. Now, if you think of it, this seems a picture of chronic fatigue syndrome or fibromyalgia. Now, the second thing I also did was to help her nerves relax. I added Califos biochemic twice a day. So this forms my dynamic prescription, that is picric acid 30 every day at bedtime. The second is Califos biochemic twice a day, just to help her nerves relax a bit more. The third and important thing I did for her was relaxation exercises. How do you relax a stiff body? What posture do you lie in to relax your neck or relax your back? It's very simple. Keep a roll, about a 2-inch roll under your neck. Just roll up a towel about 2 inches, keep it under your neck. Roll up a bigger towel about 4 inches and keep it at the junction of your lower back and sacrum. That is just above the pelvis, where you see the dimples of the sacrum. Lie down straight on a bed for at least 20 minutes. I repeat again, a 2-inch roll under the neck, a 4-inch roll under your back, just above your pelvis. Lie down on a flat surface without a pillow for at least 15 to 20 minutes. Stay out of your spine. This is one of the exercises I taught her. The second was a breathing exercise. As you all know the benefits of yogic breathing exercise, like for example, pranayama, how relaxing it is. And it is also recommended for people with blood pressure. It is also recommended for people with anxiety, depression, to elevate your mood. So these are the two suggestions that I started her off with. And I told her, do not do any physically strenuous exercise. And the fourth thing is relaxing foods in her diet. Most of y'all, I read from the chat, have suggested milk. Some have suggested banana, chamomile tea. They are good suggestions. But I'm going to give you a very unique one. Remember this from Boric. It is a mountaineer's remedy. It removes fatigue from mountain climbers and people who reside in high altitudes. Which one is it? It's cocoa. It's chocolate. So dark chocolate, 70% dark chocolate, one piece of it at bedtime is a wonderful relaxant. It is an aphrodisiac. And just introducing this as part of your diet can do wonders to help your mind, to help you relax. So this was my prescription. But this is the most important part of treatment. What can you do to help create a better state of mind? This is an area I feel that as homeopaths, we are pre-equipped to handle, but we seldom utilize it to the maximum. What would you do to help change her state of mind? So here I would like to narrate a story. It's not exactly a story, but it is a part from the mind therapy which I did for this patient. And a part of mind therapy, if you all are aware, is a part of hypnosis, a part of neuro-linguistic programming, a part of counseling, a part of psychotherapy, a part of philosophy, spirituality, whatever you wish to call it. So it especially helps us uncover the mental roots of illness. Now, all this patient knows right now is that she's anxious. She knows she's anxious because of these factors. But my question to you is, why did she learn to be anxious in the first place? What life event happened, or what conditioning took place in her life that she started becoming anxious? So I'm going to narrate what she said and what was her experience through this session. It was simply spellbinding to observe how accurately it is linked. Now, a part of the process involves experience. Experience at a level where you can understand how an emotion is somatizing on your body. Are you all familiar with the concept of somatization? If not, I will be coming to it in the next slide, but just bear with me for this moment. Somatization is a physical effect of a mental phenomena. And all I wanted to understand, what is the mental phenomena which is somatizing on this patient right now? So as I took her through this process, she regressed to an age of 11. She says, I'm 11 years old. I'm in the house surrounded by my aunts. And all of them are telling me, you are stupid. You don't know how to do things. How will you ever grow in life? Imagine saying this to a 11-year-old. And what was her reaction at that time? She was frozen. Her entire body, her entire spine was frozen stiff. In that moment, she experienced it. She said, as I'm feeling this, I am feeling scared. So fear is affecting physically her entire spine. Now tell me, if you know this, how does it change your prescription? Or does it really need to change your prescription? Can you help her remove this fear right here, right now from her mind? So as we took her through this process of mind therapy, as we helped her release this fear, for the first time in 4 years, she was pain-free. Just imagine you are 4 years in pain, not simple pain, a pain which doesn't allow you to sleep, a pain which doesn't allow you to function, a pain which doesn't allow you to be social. And imagine letting that pain go in just an instant. What is the kind of relief that you would feel? That is exactly what this patient felt. But this relief did not last. Why? Because she just understood her fear. She still has to work on removing her fear, changing her mindset of fear. So after that, we kick-started an entire process of how she needs to understand her fear, how she needs to understand the energy behind fear, how it is somatizing on her system, and use it. Not bow down to it, not suffer because of it, but use it to strengthen herself, to become a better person. This is what I did for her. And like I said, somatization. It is the physical experience that is an objective experience of an emotional one that is subjective. The idea is to understand how we have conditioned ourselves to react, both physically and emotionally. What was the point in your life where you decided, I'm going to behave this way, I'm going to react this way? If this happens this way, I will feel this or I will feel that. How many conditions have you set? This process helps you understand all of those and also change it. So this is a feather to our cap in the treatment. And as homeopaths, as part of our case taking, it just takes very little to jump to this level and change the patient right there. So I'll now be sharing with you the follow-up. First 15 days, The cervical pain went down by just 5%. I'm talking about 15 days, not the immediate relief she felt after the session. The cervical pain went down by 5%. The lumbar pain went down by 10%. Her sleep improved and she was waking up with less pain in the morning. Anxiety, there was a big change. She started realizing that I am becoming anxious. This is a very crucial step. Just imagine you know a wave is coming and you know, okay, this wave is coming and you're not falling under its trap. This happened in the first 15 days. At the end of 1 month, her neck pain was 25% better, back pain was 50% better, sleep more or less the same, and anxiety, there were fewer episodes but shorter episodes. Now at the end of 3 months, neck pain, as you can see, is improving very slowly. It improved by 40%. Her back pain improved in a good manner, that is by up to 70%. And sleep is definitely better than before, but it keeps on fluctuating between good and bad. But the main change I observed in her was in her anxiety levels. She said, I'm feeling more confident about myself. I'm feeling more comfortable in the amount of energy that I have and how I can use it. And at the end of 6 months, her neck pain is 75% better. Her back pain is 80% better. Sleep, more or less the same. Well, you have lifestyle to blame for that. And anxiety, there are rare episodes, but overall, she is good. So this case is where I used 4 things. I used a dynamic agent. I used a physical modality. I used nutrition. And I changed her state of mind. So when you do all of this, you are not only helping your patient feel better in a much quicker time, but also helping them trace a better route to a healthier lifestyle. Now, this is a point which I can go on and on about. Is disease the only thing we should identify with, or we should also identify with a better version of ourselves? So why can't we work on removing disease, also improving our state of health at the same time? This is the idea, and this is what led us to the idea of integrating multiple therapies, which are symbiotic. Trust me, none of them go against each other. So this is the case of this patient, which we had a wonderful follow-up with, and I still see her every month. She comes just to talk and understand how she can become better in her mind state. Her pains are negligible. She has gotten back to work. She's a freelancer. She does her work by herself. So this is the first case of fibromyalgia where I have tried to demonstrate an integrated approach and how as homeopaths we can think laterally and provide substances in different manners to help the patient. I would like to share a few more examples of picric acid, like a case of lumbar spondylitis, where the third toe, fourth toe, and the little finger started becoming paralytic. There was no sensation in the leg. There was just a sharp shooting pain in the gluteus muscle. Typical lumbar spondylitis, or sciatica as we commonly call it. So this patient, being a homeopath herself, she had taken colocynth, she had taken nephallium, she had taken rustox, she had taken magphos, and then one fine day she was like, I cannot feel any change. And being a friend of mine, I told her we need to do 2 things: acupuncture, and we have to change her medicine to picric acid. The moment she took picric acid, she slept well that night. The second day, she said, I can feel some numbness in my toes. I can feel pins and needle sensation in my toes. The third day, when I met her, actually, I gave her treatment, that is acupuncture. And after that session, her pain literally vanished. So what worked in this case? Would I give credit only to homeopathy? Would I give credit only to acupuncture? I give credit to both of them because both are dynamic sciences, both were required to be done. And that is what each and every one of us must learn today. How do we integrate what we know right now in our practice to give a better quality of service to our patients? Picric acid is a fantastic remedy for all sorts of neuralgias, and also picric acid salts like ferrum picricum, calcarea picricata, and alumina picricata. I have had the privilege of using picric acid and ferrum picricum a lot in my practice. I would highly recommend reading through those remedies through Boric, Clark, Fatak, or any source that you can. Because the main thing about today and how relevant this remedy is today is every one of us is tired. Every one of us is stressed. Every one of us is trying to do something which feels just beyond our capacity and we are struggling to reach there. And in this lifestyle that we maintain, there is no balance. We don't take care of our food. We don't take care of our exercise. We focus on just working, working, working. We don't work on keeping our mind state healthy. Picric acid is a fantastic remedy for that, and even ferrum picricum. Please read through them. And secondly, now I'll just like to share a small case. It's a case which is very simple. Most of y'all should be able to guess this medicine. So this patient, she's a 53-year-old female. She's very lean, and as she walked into my cabin, she was limping. And she was limping to such an extent that she could not move her ankle and her knee. And when she came and sat on my chair with her legs straightened out, she just raised her trousers, and I could see a big swelling, like literally the size of a tennis ball, around her right lateral malleolus. There was tremendous pain, there was tremendous tenderness, it was red, it was hot, and there was no range of movement at the ankle. The slightest movement gave pain. And the same pain was there at the knee, but to a lesser intensity. Same, it was on the lateral side of the suprapatellar region with minimal swelling and tenderness on examination. Now, only one thing she gave me was the pains keep on shifting between these two joints. Only one joint pains predominantly at any given point of time. That is, either the ankle hurts more or the knee hurts more. And this history, 90% of it was given by her husband and not the patient. Some associated complaints, there was pigmentation over the skin, especially the bony surfaces of the hands and legs, with a tendency to scratch. It was dry skin with pigmentation. She's on hypothyroid medication since the last 14 years. That is, I think, 75 mcg of thyroxine. And she's pre-diabetic, but not on any medication for it as of now. A little bit of background, she had suffered from shoulder rheumatism about 14 years back. And at that point of time, she was given a full course of anti-rheumatic medicines, that is Sazo, Methotrexate, as well as FCAH. And at one point, if I remember correctly, she was even given steroids to control the pain. Through that episode, she took almost 4 years to get out of. Now again, I'm talking about 2020, 5 years back, just 5 weeks back. 2020, 5 weeks back, she comes to me with this pain. And as I talk to her, she's not very interactive, she's very closed. And some of the generals are all normal, like thirst is good, she's comfortable in all weathers, her appetite is good, bowel movements are regular, menopause was at 48, cycle was regular prior to that, flow is normal, no clots, no evident symptoms at menopause. All is normal. Then what is the reason for this rheumatism to recur? So I went on to inquire about the mind state. And this emoticon aptly explains her. Her mouth was shut. Literally, She said, "Doctor, there's nothing wrong. I'm okay." And her husband volunteered to step out of the room. I was hoping that she'll come up with something, but she didn't. Then I'm good. Life is good. There is no problem in my life. It's just this pain. So this is all the history that I had. Based on this, what remedy would you come to? The X-rays showed a mild tissue swelling, and there was a mild sclerosis along the lateral malleolus. Her ESR was 91, her hemoglobin was low, her CRP was elevated, but anti-CCP was negative, RA factor was negative, uric acid was normal. The first thing that I always do is come to a diagnosis. What is the diagnosis? I feel it is pretty straightforward for all of you. It is seronegative rheumatism. Seronegative rheumatism of her ankle and knee, which earlier might have been possible, which we are seeing a migration of the rheumatism from her shoulders to her knee and ankle. So what do you do in this case? What would you take? And what all should be done? Think about everything. Again, go back to the first case, go back to my suggestions, and try and think for yourself, what all could you do for this patient besides prescribing a remedy? So this was my integrated prescription. The remedy I gave her was Lidempal 30, twice a day. The tissue salt which I gave her was Calcarea Fluor 6x, twice a day. I put her on an alkalizing diet. I removed milk from her diet. I removed curds from her diet. I removed sour foods from her diet. I removed foods and fruits with a lot of seeds from her diet. For example, brinjal, tomatoes, ladyfingers. I removed all these things from her diet. And lastly, about the mind. Do you all feel the mind needs to change? Yes, it does. Because all you can see is only her body is expressing her symptoms. That means that there is a suppression at some level or the other. I patient therapy, the mind therapy that we do, and she regressed to a time in her life when she was 22. She comes from a village background. She was married at the age of 22. She didn't even see her husband, but all she knew that was my husband is a very handsome man, but I don't think I am good looking enough for him. I don't think I'm worthy enough for him. This is the thought process that came up in her mind. And as I probed deeper, she said, I am afraid to get married. And all the things that she said before were just reasons created by that fear. So once more, we have fear which is affecting the bones. Think about this. So I helped her release her fear, and her fear somatized in her knee and ankle. This is the beauty of therapy, mind therapy, that the emotion somatizes in the exact place where the current symptoms are. And the moment we help release her fear, she started responding immediately. On the funnier side, her husband came back to me and told her, Doctor, what have you done? Why is she talking so much? I'm like, I can't help it. You have to get used to a new wife now. She started talking so much, as if she was quiet for all these years. She became so expressive, and I could see the changes instantly. And this is what it looks like. This is the materia medica of Lidempal from Bogers and Boric. The main keynote I took for my homeopathic prescription was that it ascends from the ankle to the knee. If you look in Boric, rheumatism begins in lower limbs and ascends. And this I'm only considering the current totality, mind you. I'm not considering the previous history of rheumatism right now, because this was my first prescription. And when the patient came back to me after 10 days, she was already better. So when that has already happened, you have taken care of the root of fear in her mind, and if the patient has improved, do you think you should change your medicine? I did not. Frankly, to be very honest, I did not change her medicine. And this is what the picture looks like. This is just yesterday. In the evening, she sent it to me. That her swelling is almost gone. There is full range of movement. Her knee is better. Her skin is slightly improving. And of course, she's talking a lot. The husband also asked me, Doctor, can you change her back to the silent version, but a healthier version? I said, I can't do that. So, my dear friends, this is what I wanted to share with you. How integration of multiple disciplines helps reduce time, reduce effort, and at the same time improve quality in the health that you offer to your patients. This is all from my side. Thank you. And this is just one thing which I wrote yesterday for all of you. Every attempt to heal is an attempt to awaken our inner potential. Think about this. Think about how you can implement this in your practice today. Thank you.
Thank you, Dr. Chirag. It was lovely, and we learned so much. And I think it was the first time we showed this as a integrated approach in such platform, and it was lovely. And I hope participants enjoyed a lot by learning, especially the newcomers and young participate. Can we take the questions?
Yeah, sure.
So the first question was from Dr. Mamta. Please throw some light how to do somatization.
Somatization is a lengthy topic by itself, but I can just give you all a very simple example right now of somatization. Have you all ever burnt yourself? Like, have you all ever touched fire, or have you all ever touched a hot substance, hot iron? What happened? Two things. One is you have the physical experience of the burn, and second, you have the mental conditioning that this is hurting me. I am afraid of it. So you start fearing something that is hot. So what is happening here is both. There is fear in your mind from a burning object, from a hot object, that every time you'll touch it, you'll automatically take your hand back. Now this is somatization. In very simple terms, this is a negative somatization. And if I have to give you a positive example, think of the best food item that you enjoy. Not chocolate, okay, chocolate if you wish. Think that you're having your favorite chocolate right now. How does it change your body language? How does it make you feel instantly? Are you really having chocolate? Or are you really just connecting to an experience in your mind which has a physical experience as well? This is the whole idea of somatization.
Thank you, Dr. Chirag. I have another question from Dr. Faiza. Can
Yeah.
you explain more about your experience with picric acid?
Lumbar spondylitis, cervical spondylitis, itis cramps, carpal tunnel syndrome, peripheral neuropathy in diabetics, non-diabetics, lumbar canal stenosis. These are all cases where I have used picric acid, sometimes as an intercurrent or sometimes as the main medicine. Where the constitutional doesn't work, I have used picric acid and it has really set the case rolling for me.
Thank you. And last question we are going to take that Dr. Ramachandra. What is the reason for going for lower potency rather than higher for speedy recovery?
Um, to frankly answer that question, I start with 30 always, because there are multiple approaches that I take to the case. So the follow-up which is seen with 30 has always been consistent. I only use high potency in acute cases of pain. Like for example, you have an extremely stiff neck or an extremely stiff back. I would prescribe Rustox in 1 m and I would repeat it very often. This is just from personal experience.
Thank you, Dr. Chirag. And thank you for a wonderful session. One more last question I'll take from Dr. Monisha. Do you apply acupuncture for all your prescriptions, sir?
Not compulsorily. But pain conditions, yes. Hypertension, yes. Chronic ailments, asthma, yes. Migraine, yes. But it is not the mainstay of my treatment. It is a part of my treatment.
Thank you. Thank you. Everyone can see Dr. Chirag email, and if you have more queries, kindly just contact him directly. It will be better. And I would once again thanks everyone for joining us today, and liking the session so much. And I think Dr. Prabhakar sir is here. Can we have you, sir, on the screen? Yes, sir. So can you unmute yourself, sir?
Did it?
I must
Yes, sir.
confess, it feels nostalgic to see Prabhakar sir because I'm seeing him after college, and it feels like I'm sitting in a class with him right now.
So nice. Thank you for
Actually,
kind.
I think it's for the first time we have someone like from the a professor and his student together at a duo combo at a webinar.
And Chirag has really spoken well. I was listening to him all the while, and very nice presentation.
Thank you, sir.
Good. We are very happy and proud both.
Thank you, sir.
Thank you all the audience for being there. Any questions? Our email has been written. You can post that. We'll answer your questions.
Thank you, sir, for joining us. I would like to thank you, Homeopathy 360, my platform, Homeopathy Key. Those who don't know about the Homeopathy Key, I would once again I'll tell we have created this platform to connect every homeopath around the world to have these sessions, events, students doubt clearing sessions. Like many people could not connect their professors. Whoever has any query with the senior homeopaths, we want to be a bridge so we can connect. We are three founder members, Dr. Snehanshu Shah, Dr. Siddharth Singh, and me, myself. So we have created this platform, and in Facebook you can find the Homeopathy Key. So please like the page and keep get updated. Along with Homeopathy 360 has given us a wonderful platform to invite such a great speakers and share us beautiful knowledge with us. And we are so happy about it, and we are blessed, sir. And thank you once again, sir, for giving us time. Thank you, Dr. Chirag,
Thank
for
you.
giving
Thank
us
you.
such a valuable time. And
Anytime.
hope we conduct these sessions again and again, and we have a lot of learning together. Thank you, sir.
Yeah, anytime. Bye bye. Thank you. Thank you,
Thank
Dr.
you.
Jitesh, Dr. Chirag.
Thank you,
Thank
sir.
you, sir. Bye.
Thank you, sir.
Bye
Thank you,
bye.
sir. Thank you.